I'm Rebecca, I'm one of the Nursing Teaching Fellows here and one of the Nursing Registrars, and this project was kind of the brainchild of Dr. Lindsay Cheston, who's one of the nephrologists at Derby, so she's obviously on there for that reason. So 2016, not that long ago, we obviously had junior doctors contract disputes, and I think that has been a real changing point in people's attitudes to junior doctors and working life. And since that, there seems to have been an increasing concern about kind of recruitment and retention of junior doctors. And I don't think it's a coincidence that then the following year there was places for medical school available by clearing, which is previously unheard of. So obviously you all know how placements at Nottingham work, but just in case you haven't been present for the last however many years, 30 months of clinical placement, 15 weeks are allocated to medicine. And of those 15 weeks, you get 7 weeks in CP1 and 8 weeks in CP3, and then obviously further exposure during the medical assistantship, which generally happens on a general medical surgical ward. So the aims of the project were to explore the perceptions of the role of doctor amongst medical students across these placements, and to assess whether these perceptions change over time. So in 2007, over a 10-month period, students at the beginning and end of their medicine attachment were asked this question, so I've got a slide of them just asked them, what is a doctor? Gave them a post-it note, and they wrote down what they thought. Students were informed that it was for this project, and they were reassured that it was all completely anonymous. And responses were collected and uploaded to a database, and after that I've done some qualitative analysis on those, looking for common themes and trends over time, and it was mainly a kind of content analysis. So, the results were quite interesting. So I had 189 responses in total, and you can see the split there across the placement, so that sort of mirrors the number of students that we get through. I haven't got an exact percentage for the number of responses versus the number of students, but we generally only drop 1 or 2 every time, so the vast majority of students filled in, that were there at the session, filled in a post-it note. So overall, I feel like a word cloud in my head, don't I? So those are word clouds for the day. 3 most popular words were health, professional and patients. And I think that probably is reassuring and marries what we would think about a doctor ourselves. Other common words are people is there, knowledge is there. You'll notice healer up in the top right, and that came up pretty much every single time. I'm not sure what we all think about that. Care and improved as well is there as well. So there were some consistent themes across sort of all the way through. So first of all, sort of caring or cares. So this is an example from the end of rotation 1 of CP1. I'm hoping you can all read that, but I'll read it for those at the back. So it's someone who cares for a patient in their entirety with a social, physical and psychological well-being. Someone else, this is at the end of rotation 2 of CP1. Someone who cares for healthy individuals who improve their quality of life. They work for long hours with limited benefit. They're only just starting clinical placement. Someone else, at the end of CP1 rotation 2, so just before they sat their exam, someone who cares and cures others. I'm not sure how much time they actually spent on placement. So I don't think I've rarely cured someone. And then this, well, I've got 2 kind of opposing ones. So these were 2 CP3 students the last day before finals. So a doctor, so source of support, well-read, non-judgmental, inquisitive, empathetic, caring, well-rounded, determined, teacher, administrator. I think most of us would quite like to be all of those things. Versus this one, which is similar, but there's a kind of quite a sad undertone to the second sentence of it. So, a person who cares, teaches and heals people and their surroundings, but they're not necessarily a kind person. They seek to improve health. There's a little bit of a disparity between the two. So moving on to some negative descriptors now. So there was a couple of themes for negative descriptors, and what was interesting was that these evolved over time, and it wasn't necessarily so. More of the negative feedback came out as students progressed through the course, but equally the same group of students at the beginning and the end of their medicine attachment, you were seeing going from positive to slightly more negative just during that 8 weeks of medicine. So overworked and underpaid was very common, so you can see, I'll read these out to you, but the kind of two go hand in hand, and I think that was a common theme in the junior doctor strikes, that kind of overworked, underpaid was one of the consistent messages and sort of slogan of the whole campaign. And these, again, as you can see, are all at the end of attachments, and particularly sort of CP3 before finals, and just en masse. So they've had their elective and they've come back and they've seen what real work is like. And then pressure is quite interesting. So the theme of pressure started to occur as the responses came through. And again, these were all at the end of attachments. And you can see that people's perception of pressure is a bit different. So someone that remains calm under pressure is clearly someone that's different. It's a bit difficult to a multi-skilled, over-pressured person. And then this one sort of at the end is a bit more balanced. So pressure isn't necessarily always a bad thing. So the conclusions from this, if you want to draw some, is that perception of a doctor is very wide-ranging, and people probably don't necessarily know what a doctor is, even though they're at medical school and going through their training. I'd be interested to see what your guys' perceptions were. Negative themes develop over time, and that does seem to be linked to being on medicine attachment, which is perhaps reflective of the fact that they are seeing doctors working. Overall, it was an overwhelmingly positive response, so the caring and patient-centred and professional were the things that came out. But I think further work needs to be done, so sort of there's a few different ways that this project could be forwarded, I suppose. So looking at how perceptions change in junior doctors, what those perceptions are and whether they change in work. Managing the expectations of students going into work, because clearly the CP3 student that thinks they're going to heal patients is probably in for a bit of a shock on the first day of F1. And also whether we actually need to look at what the lives of junior doctors are like, because I think it's fair to say that a lot of the time people do feel a bit overworked and under stress, and the perceptions that the students are getting are probably not inaccurate. So whether there's some work to be done there as well. And that's it.